Thank you to all you early birds who are joining early. We're waiting for others to join. I can see there are people from, my goodness, Georgia, Geneva, India, Bangladesh, Nepal, IOM Nepal, Costa Rica, very good. People from Ministry of Health, from Unitate, hello Nicholas. We have more people, IRCS from Mumbai. Lenny from Indonesia, University of the Philippines, really great. Kyrgyz Republic, wonderful. Sri Lanka from my own country, Yemen, Nepal. So we're getting people from all over the world. Thanks for your patience. We're letting others join. Niger, we have WHO colleagues from there. Austria, Somalia. We're really circling the globe. Myanmar, Puerto Rico, South Africa, hello NZ. Nigeria, Afghanistan, wonderful, from US, Timor-Leste, Uganda. So the list is really growing now. We're nearly at 200. We'll wait a few more minutes. Sudan, Canary Islands, Spain. So Croydon, UK, Tanzania, more from my own country, Sri Lanka, Kinshasa, colleagues from New York, from Brazzaville, Saudi Arabia, Italy, Nepal. I don't see anybody from Australia yet, Pakistan. I think we're covering all of the continents, Lebanon, Australia. People are calling from lockdown in certain countries. Welcome, Burkina Faso, Tajikistan, Senegal, Florida. I think we're missing Antarctica and the Arctic, but I think we're getting a very good spread of people. Mali, wonderful, Jordan, Fiji. Must be very late in the night in Fiji. Eastern Sudan, Mauritania, Egypt. Wonderful. We are going to take, I think I would like to take a couple more minutes, let people come in. Bangladesh, Yemen, Cape Verde, Libreville, UAE, quite a few from India, Zimbabwe, Thailand, Cameroon, New Zealand. Again, must be late in the day. Must be 1 a.m. in the morning. No, it must be about 11 o'clock at night. Ukraine. We're going to start at 5 past, so I beg your patience, and please keep writing where you're from, what you do. We would love to hear from you. Use the chat. I think we have participants from our previous webinar, so people are saying hi, hello everybody. This is part of a long webinar series, hashtag Learning Saves Lives. Germany, I can see, Mali, more Nepal, Dakar, Sweden. I'm just going to say the new countries now, okay? Eritrea, Niger, I said South Sudan before, Saudi Arabia, Wonderful. And I can see colleagues from UN agencies, I can see students, I can see others without affiliation. It's wonderful to have a mix of experts, of professionals, of practitioners, of the public. We have Ethiopia, I can see. Okay, Uganda, I said that.
Hello, Gaia, you are muted.
Gaia, you need to unmute. We can't hear you.
Gaia, you are muted.
There you go. Dr. Sose, welcome. We're just waiting to start. People are still joining. We will start in about 2 seconds.
Good afternoon, good morning, colleagues.
Thank you.
Good.
Okay, I see more of my compatriots from Sri Lanka. That's also very nice. Great. Rita from Kenya. Okay, so we're getting up to about, we're getting above 350. So I think we are 5 minutes past, and I think we would like to start. So welcome to our webinar. This is a webinar on protecting communities from sexual exploitation and abuse. And the question we're trying to ask and answer is, what are we doing, and are we really doing enough? I'm Dr. Gaia Gamhevage, and I work for the World Health Organization. And I'm very pleased and proud on behalf of WHO to host all of you and our very, very distinguished speakers today. I am currently the director for the prevention of risk and response to sexual exploitation, abuse, and harassment at the World Health Organization. I will be your moderator today, so I will not be a speaker, but I will use my moderator's prerogative to say what I like. So this webinar is part of a series called #Learning Saves Lives. But this is the first time we are focusing in on sexual exploitation and abuse. And it's meant to be an open, honest, and exchange, a conversation amongst all of us on a very complex and very dark and tragic topic: sexual exploitation and abuse of communities we serve by development or humanitarian partners is an unacceptable, catastrophic failure of our duty to serve. So this is a very serious topic, but it is also equally complex. And that's why we understand that coming together, hearing what we're doing, brainstorming together will help us move forward. The commitment is there, but there is a lot of work to be done. I must say, on behalf of WHO, we have like everybody else here, we have a zero tolerance policy towards any form of sexual exploitation and abuse of the communities we serve. And although we're not going to talk about it today, also a zero tolerance for sexual harassment of our workforce. We want to capacitate our workforce, our partners, our collaborators in this area. So as I said, joining forces with partner agencies, especially those who have gone before us and done excellent work that we can learn from, I think would benefit not just WHO, but also the survivors and the victims that really are at the heart of this issue. For the rest of 2021, we're going to organize more webinars, and different speakers and agencies will join us. And I really want us to see this, as we live in a social age, as a social exchange platform, a learning platform. This one will really look at what we are doing and the challenges we face. So let me give a couple of words on the practical aspects. This webinar, as you know, is being recorded and will be shared widely afterwards. By continuing your presence here, you consent to that. Now, this means that we have to agree to interact respectfully. with speakers, with participants, with anybody. No information on specific events of misconduct, of SEA or incident should be shared in this forum. This is not what this forum is about. And my colleagues will post on the chat if you have an incident you want to report, where you can send that. Every agency here has reporting mechanisms, and we can report accordingly. This is not the forum for that. So as I said, let's be open, let's be honest, let's be respectful about this issue. This webinar is in 3 parts. The first part, I'm going to introduce our speakers one by one, and each of them is going to speak to you for 5-6 minutes about what they're doing, right? And different aspects of what they're, not the entirety, but some aspect of what they're doing. After that, we're going to have 20-30 minutes where I'm going to pose some questions that address the heart of the issue. Are we doing enough? What are the special challenges? And then I'm going to take questions from the audience and level them to the speakers. This is how I want you to interact. I want you to interact respectfully in the chat. Tell me about what you're thinking. Tell me about what you're feeling. Tell me about your thoughts and comments. But if you want to pose a question that you want me to pose to the panelists, I'd like you to write it in the Q&A box. Okay, so go to the Q&A. If it is a real question about the topic, to the panelists. And I, of course, have the prerogative to choose the most popular questions. All right, so that's how we're going to go. We are going to keep to 90 minutes. So to set the scene, not all of you will be working in prevention and response to sexual exploitation and abuse. So let me just take 2 minutes on this. So what do we mean by sexual exploitation and abuse? And the definition is the real, the actual, or an attempted abuse of a position of power, of vulnerability, of a power differential or trust for sexual purposes. So, and we are referring here to anybody who is a development actor or even more a humanitarian actor, because we know SEA risks go up in emergencies because power differentials and vulnerability goes up. So for example, if an aid worker solicits a prostitute, if an aid worker asks a beneficiary to have sex in exchange of relief, of resources, of aid, the promise of a job, this all constitutes sexual exploitation, and it may be also sexual abuse. Now, SEA can be committed by anybody, and as I said, in our context, we're talking about the workforce of our agencies, of development and humanitarian actors, our volunteers, but also our implementing partners. So NGOs, government personnel who work with us, service providers. Again, it can happen anywhere, but we know people are most vulnerable in emergency settings. I want to underscore this issue is more about power differential than it is about sex, right? So we have to understand it is based in gender inequality, power imbalance, and absolute disrespect for human rights. These are the roots of this. It is a form of gender-based violence. It doesn't matter how we try to couch it. And our workforce, and all of you out there working, we need to acknowledge the power we hold as development and humanitarian actors, the power we hold over populations, and the very many ways in which this power can be abused. So unless we acknowledge that, we can't address this. So this is setting the scene. For WHO, we're at the beginning of a journey. We have come to this topic later than many of the agencies here. So we are happy to learn, but we also, every agency has its peculiarities, and I'm so happy that we also have a very senior leader from our organization to talk about what we are doing as well. So let's get started. We're in the first part of our webinar, and I'm going to start inviting our speakers to speak one by one. I'm going to ask them to speak to about 5 minutes, all right? So the first is somebody, when I started this job recently, who actually really helped me understand what's going on, and her generosity is really, really appreciated. And this is Wendy Q. She's the Senior Coordinator for Prevention and Response to Sexual Exploitation, Abuse and Harassment in the United Nations Office for the Coordination of Humanitarian Affairs, Psca. She's an expert, but she's also a very generous person. She's been with the IASC, the Interagency Standing Committee Secretariat, since 2018. Previously, she was head of OCHA's Regional Office for Latin America and Caribbean since 2015. Very illustrious 20-year-old career. I'll just give you some of the places she's worked in Nepal, in Rwanda, in Haiti, in Guinea-Bissau, Sri Lanka, Pakistan, Cape Verde, and much more. So it's too much to go into. I'm really happy you are here, Wendy, and you have a very special role, not just as a single, but as an entity that brings all of us together. So the floor is yours, Wendy. Go ahead.
Thank you, and welcome to all the participants. I see there's many staff from the World Health Organization, but also a lot of partner agencies and other partners that are online. So for those of you who are not so familiar with the Interagency Standing Committee, as you know, it was created by the UN General Assembly, mandated to ensure coordination in humanitarian emergencies. One of the dangers when we have a lot of responders is that there is either duplication of efforts or, even worse, a gap in efforts. So it was really created to ensure coherence of our approach, bring harmonized policy, and ensure that there is operational decision making, especially as Gaia underlined in some of these emergencies. We are trying to act quickly. We are really trying to make sure that we are doing the best to save lives. And so what we've seen also on protection from sexual exploitation and abuse, it's even more important than ever to have a harmonized approach. Historically, we've seen a lot of coverage on where there's been peacekeeping scandals, but also in the humanitarian environment, in camp-like settings, there's huge differentials of power. And in recent years, unfortunately, there have been very mediatized events that have affected some of our key partners. And the reflection in the community is, while this happened to this partner and the sanction was defunding or a lack, what the mechanisms we have in response to some of these incidents is that we, put our funding on hold. But what does that mean? Maybe some of the affected communities or some of the places where this partner was working is not receiving the assistance that we're trying to deliver. So is this really the right response when we're punishing or we're depriving communities of assistance because of the act of one perpetrator? So there was another article recently where one of the executive directors of our partner agency spoke about how, we're trying to act quickly, we're trying to save millions of lives, and then there might be one incident or two that detracts from the whole effort. And so we can't do one without the other. It really is a question of the quality, the appropriateness, and the effectiveness of our assistance to ensure that we really are doing no harm, that we're upholding the highest professional standards of conduct. In these humanitarian environments where we're operating, often there's a lack of rule of law. We only have limited partners that we can work with. We have problems of access, and that really all increases the risk of exacerbated power dynamics. So what we are looking at as a humanitarian community is ensuring that we have a standardized approach, and we look at the programming that we can adjust to really reduce some of those risks. Gaia asked us to highlight some of the three main challenges from our perspective. And for the Interagency Standing Committee, I think the challenges are around coherence, credibility, and capacity. And we're working really on all those three areas. So coherence, as I mentioned, is having a harmonized code of conduct. The Interagency Standing Committee has 6 core principles relating to the Psca, to protection from sexual exploitation and abuse. Really, that everyone knows what are those 6 core principles. No sex with anyone under 18, sex between a humanitarian aid worker and a beneficiary is prohibited. I'm not going to go through them all right now, but those 6 core principles really should be embedded, and everyone should have access to them on pocket cards, on signs around wherever there's operations. And that these codes of conducts are promoted at the country level for the whole humanitarian operation. So really a coherence in approach. How do we share information? How do we ensure that that information is protected? How do we ensure that the victims have access to services? And you'll hear more about that from some of the partners on this panel. The second area is around credibility. We can't promote accountability if we don't have faith in the system. We have to be credible when we say, if you report something, it will be followed up, that a whistleblower or someone providing that report will be protected, that there is a time frame for the investigations, and it's done in a professional way. And the third area is around capacity. We've seen the difference in having people who know all of the aspects around prevention, protection, upholding the standards, where to refer people. You have to have that dedicated capacity at the point of delivery of humanitarian assistance, not just at the national and the capital level. People are focused on delivering their programs, and it's great to have that kind of Psca capacity so that they can refer any reports. We've seen in some operations where there are, for example, rumors of misconduct, and we can't just leave those rumors. People don't have enough information to act upon it, but if you have the dedicated capacity to do some fact finding and to really translate those rumors into, stopping in a potential allegation and documenting the case and bringing that to account, to the perpetrator to account if it does get confirmed, this is very important that we have that capacity at the field level. So again, the Interagency Standing Committee really around coherence, promoting credibility of the system, belief in the humanitarian enterprise, and our capacity. And I'll stop there and look forward to the discussion later. Thank you.
Thank you so much, Wendy. I think it's already addressing some of the questions that are being asked. I'm going to invite all of the speakers to keep checking the Q&A. And if there's something where they have expertise, please volunteer to answer that as well. Thank you so much. So 3 big messages that I'm hearing from Wendy is, how her office and her teams are trying to create coherence, credibility, and capacity across the system, right? So from the point of view of survivors, victims, we are all one group of people, and we all have to behave in a very consistent way. Next, I'd like to introduce Dr. Ibrahim Fall. He's the Assistant Director General for Emergency Response at the World Health Organization. He was previously our organization's regional emergency director for the Africa region. His extensive experience at the country level, at the regional level, all types of leadership jobs in public health, but also more importantly in health emergencies. He was also appointed by the UN Secretary General as Ebola Crisis Manager and Head of UN Mission for Ebola Emergency Response in Mali in 2014. He's had senior jobs in rollback malaria and in the malaria program. So it's a pleasure to have you, Dr. Sose, here today. I'm going to give you the floor just to outline, where WHO is in this particular very, very important topic. Over to you.
Thank you, Gaia. Good afternoon, good morning, colleagues. I think Wendy and yourself, you have set the sun very eloquently. And for WHO, what is specific for the emergency program is a new program. You may recall that after the West Africa Ebola outbreak, we went through a reform to set up the new emergency program in 2016, starting operating in 2017, meaning we are now more operational and deploying more and more to very difficult areas where we have humanitarian crises. It means that we are also more exposed to certain type of risk, including sexual exploitation and abuse. And so we need to adjust. We need to make sure that while we are being stronger in terms of, public health operation, we have all the means to prevent sexual exploitation and abuse. As already highlighted by Gaia, we have zero tolerance to sexual exploitation and abuse. But, we need to materialize it. It's not just about saying it. Most of the time when you talk with people working in other departments in charge of, crisis management and others, they will tell you we have the policy. But if you don't have the policy and you can't implement them in the most remote village in, a given country, what does it mean to have the right policy? So that's why we have a lot to do, and we have a lot to learn from organizations that have been already exposed to this type of challenges, because now we are, getting report of allegation of sexual exploitation and abuse, and we need to adjust to be in a more preventive mode than what we have seen so far. And so it's not only in the emergency program, but at corporate level also, we are making a lot of progress as materialized by the appointment of Gaia as a acting director in charge of prevention of sexual exploitation and abuse on sexual harassment, working across WHO on linking all departments, all directors, and people who are accountable for this to constitute this task team. And I think you have made very important progress very recently from the emergency program as well, making sure that we analyze our policy to look exactly where do we have gap in terms of implementation, looking also at our operation in all countries, having a monthly call with our WR to see exactly what is happening and how we can help them to strengthen PCA work. And another pillar is really on a capacity building where we work with our Misconduct, the former Gaia team, to make sure that we are not only, doing the standard training we used to see, but we are adapting really our training to the needs and taking into account the need to be, more consistent in following up exactly how this training is impacting our, behavior at the country level and the field level. So, and in the recent outbreak, most of the time, WHO is the first organization to be called, and we deploy within 24 to 72 hours, and sometimes deploying hundreds of people. And we also recruit people locally who are not WHO staff to work with communities. So it's important when we talk about training on PCA to make sure that our contractors also are fully briefed and trained, and also having possibility to inform communities about what they can expect from our staff in terms of prevention of sexual exploitation and abuse, but also in terms of engagement, because we have seen that most of the time, even when you work in the inter-UN system, the communities really don't have access to the tools to report when something happens. So this is something we need really to correct. And we used to say when we are fighting viruses, we put in place what we call active surveillance to make sure that we can detect the virus, for example, the Ebola virus in the community. But if you look at PCA, we are not seeing the similar, proactive way of detecting problem. I think this is something we need to take into account moving forward. So we are also very active, the Interagency Standing Committee, PCA network, contributing to the funding, but also the deliberation. And in addition to the PCA coordinator in the ISC group, we are also identifying countries where we need additional capacity for WHO to continue working with our UN partners. So we are revising our inter-system, and right now in our new draft version of what we call our emergency response framework, we have introduced a whole section on PCA. If you look at the previous session, we were only focusing on technical intervention and logistics and others. Now we have this entire new section on PCA, and with clear indicator to make sure that in every operation we take it as a priority pillar like any other intervention. And in the recent deployment also, like Ebola in Guinea, the Tigray crisis and others, we also make sure that we deploy early enough a PCA focal person to really work since the beginning to really take into account everything we need to do to be more preventive than reactive. So I'll stop here, Gaia, and wait for questions. Thank you.
Thank you so much, Dr. Sose. So you can see the different agencies are trying to come at this in many different ways because it is truly complex. So we'll come back to the issue of infectious disease outbreaks, which pose further challenges. Next is Mariska de Kiersmaker. She's the Protection from Sexual Exploitation and Abuse Officer with the International Organization for Migration. And IOM has been an agency that has done a lot for the entire community, not just for itself in this topic. So it's really my pleasure to invite you, Mariska, to take the floor.
Thanks so much, Gaia, and thanks for everyone for organizing this incredible webinar and to be part of this very distinguished panel. I feel very honored and humbled. So my name is Mariska de Kiersmaker, and I'm working on the dedicated interagency PSEA project within IOM. And just to quickly explain what we do, we have a very unique project, because what we do is we support all in-country PSEA collectives on what to do on PSEA at country level. So we're not only working with IOM, we're really working with all organizations that would need our guidance or support on really implementing, as Wendy was so eloquently saying, those harmonized standards coming out of the IASC and the guidance being provided at global level, learning lessons from country level, feeding that back to global, and making sure that those two levels are talking to each other. My key takeaway to share with you today is what we really need in this work is more coordination on this issue, both at the global level and at the country level. We are, if we're not coordinating, just simply losing resources, losing capacity, we're losing opportunities, we are losing complaints, we are losing engagement with beneficiaries, because we're not enough speaking in one voice on this issue. In recent years, I will say that we have made progress to set up coordination bodies, both at the global and at the country level. And because of this audience, I quickly wanted to show you this slide showing the in-country PSEA structure at country level. So you will see on the slide that these are the actors that we are mainly working with at country level. So in purple, you see the senior level, so the humanitarian country team, UN country team, led by the humanitarian resident coordinator. I'm sure everyone is on this call aware of all of this. They are ultimately accountable for PSEA at the collective and the organizational level. And then in the blue, at the technical level, we have in recent years, thanks to all the good work done in the IASC, established that ideally there should be an interagency dedicated PSEA coordinator. You see that in the middle between the senior level and the network. And why is that? Because the coordinator is leading the network, providing that linkage with senior leadership, which is so important, right? Having senior leadership support for the work that we do. And then you have the PSEA network consisting of PSEA focal points. And I'm sure on this call, there are a lot of focal points present, and we will talk a little bit more about the PSEA focal point roles and responsibilities. But just to show you that the work that we do is very linked to the affected communities that we serve. And this is what you see on this diagram, is that there should be a clear linkage between the affected communities and the technical level interagency PSEA network. Because of course, the people that we serve should have an active say in how we design our programs and how we mitigate risk of SEA, as well as how affected communities wish to complain, how they want to come forward, what their preferences are, how they want to be approached with communication, how they want to be engaged in different initiatives. So this should all be an integral part of how we structure our work. Thanks so much. I will also quickly maybe go through some of the key challenges that we have identified in our work. So having introduced very quickly, this PSEA in-country interagency structure, what we see very often, and I think is relevant for this group, is that PSEA focal points do not always have enough clarity on what they should be doing on PSEA. It's not always, their role on PSEA is not always embedded in their terms of reference. They're very often triple hatting, so they have many other jobs. They are not always, PSEA focal points are not always capacitated. Capacity building has come forward in the other presentations, but it's really important to stress how important capacity building is for PSA focal points and how to strengthen that, and having a clear understanding of those roles and responsibilities. Secondly, there is not always enough clarity for PSA focal points, what they should be doing at the collective level on PSA. So as you probably know, the PSA focal point is both working at the organizational level. So for instance, if you are a WHO, let's say, PSA focal point, then you will be working very hard to set the structures in place within your organization. But at the same time, you also have the opportunity to contribute to the interagency collective level. So when we're talking about that, we mean the PSE network, right? So having a clear understanding how to contribute to our collective deliverables is very important. A third challenge that I would like to raise within our work is that, yes, how great it is that we've now established a collective structure on PSA at the country level. We applaud it, we are very happy with it, but at the same time, we need to work harder as a collective to collaborate with other key actors in country that are essential to PSA work. When saying that, I think specifically of accountability to affected population actors. So anyone who is engaging with the community, as well as gender-based violence actors, because I can't stress it enough, survivor support and victim assistance services will be provided by GBV actors most of the time in country. So it's absolutely essential for PSE actors to collaborate with our GBV stakeholders, but also our child protection stakeholders. And we as a humanitarian and development community, of course, also hold the responsibility to improve their programming. And so that means raising funding for services, making sure that the existing complaint and feedback mechanisms that are set up by accountability to affected population experts, that they can receive sensitive allegations, that they are capacitated to do so, that they have the necessary resources to do so. So thank you so much, and over to you, Gaia.
No, thank you, Mariska. I'm hearing from you, you know, you were talking about the clarity, capacity, and the collective work of all of these human resources we have, the focal points and so on. And also you again, like other speakers, are talking about our accountability to communities. And that itself is going to be a topic in the future, because that itself is very, very complex. Thank you. Next, I'd like to invite Domenica Constantini, the PSA EA specialist from the United Nations Population Fund, to speak. And UNFPA has a very special role this year as the champion across our system on this issue, because we know that vocal, strong leadership is a very important part of the work that we need to do. And Domenica is a consultant for the Humanitarian Office here. She has practical experience in gender-based violence programming in emergency contexts. She's also worked in many locations: Bahamas, Turkey, Mozambique, Syria, Somalia, Iraq, the list goes on and on. So Domenica, thank you very much for joining us. And if you can speak to us particularly about the championship that UNFPA has been really delivering, if you like, in this topic.
Thank you.
Thank you.
Thank you. Good morning and good evening to everyone. Thank you to invite UNFPA to this panel. So I'm going actually to explain in 5 minutes the experience that UNFPA is having in this year of the championship and the achievement that we have made so far. So if you can put up the presentation, Andrea, thank you. Yeah, so basically UNFPA is assuming this year is busy with the championship this year, and the championship is taken over from UNHCR. That was the championship of the last year, and basically the rule of the championship is to keep the issues of PSA high on the agenda of the humanitarian leaders. It does not affect or alter the existing PSA accountabilities at the country level. The main priorities of this year championship are basically three, and are in line of with the Interagency Standing Committee PSA strategy, championship strategies, and basically also are in line with what Wendy said to push forward the coherence and credibility and capacity effort. And talking about the priority, we have the priority number one, that is about bolstering PSA country mechanism. Priority number two is related to victim assistance, strengthening information and access to quality assistance. And priority number three is about strengthening coordination and cooperation towards having a coherence approach. Going to the next slide, so priority number one, this year UNFPA managed together with the other member of the Interagency Standing Committee, not alone, she was leading, but with support of other, a pool of experts of 21 PSA coordinators of UN P4 and P3 level has been selected and trained by IOM actually with the PSA training coordination package, and now are available for deployment to the PSA Interagency coordination roster. Under this priority, we have also an ongoing independent review of the PSA approach to assess the impact and effectiveness of the measure of the PSA measure implemented so far. The last review was done in 2010, so it will be interesting to know to find out the progress that countries and organizations have made so far, and if the recommendation agreed in 2010 has been implemented. The review focus on action taken across the agency at country level, and specifically for countries where there is a PSA network in place. And the review will be finalized in October, and findings and recommendations will be also presented at the final roundtable discussion that UNHCR will organize in November. And if you want to have a more, if you have a question on the independent review, then Carly is leading this work, is able to answer. Going to priority number two is the priority that focusing on strengthening victim assistance. So basically, we believe that UNFPA having this rule of GBV, having the mandate on GBV and leading the GBV area responsibility, we thought that working on improving GBV case management service provision would also contribute to improve the quality of victim assistance. So the work is ongoing. It is on development of the ESCA training modules for GBV case management that address the particular need of survivor of SCA. We know that GBV case management services, GBV service in general, are underfunded. So we believe that is one of the safe and compassionate entry point for a SCA survivor, and through the case management they would be able to get a comprehensive package of services tailored to the need of SCA survivor. To do that, we did a consultation with PSA coordinator, PSA specialist, and also investigators, because GBV case management case workers should know about the investigation process, how about the challenges and how does it work. And then the consultation was done also with GBV service providers, and those findings will be then shared in a workshop that will be conducted in September, that is called Building Bridges Between PSA and GBV to better coordinate and responding to victim assistance. So we believe also that the coordination between these two areas of work are important, because there are topics topics that intersect to each other, overlap to each other, such the survivor-centered approach, the mandatory reporting, and the informed consent, and the fact that the victim should be at the center of the process. So there are issues that are still need to be discussed together. The module, the SCA module, will be launched in November through the GBV case management e-learning curricula. Priority number 3 is the final activity that we are going to organize, is a high-level roundtable discussion to strengthen PSCA coherence and coordination. In this roundtable discussion, we'll be presenting the recommendation of the independent review to find, way forward and action to be taken ahead. Thank you very much.
Thank you. If you stop sharing, yeah. So actually, before you move on, Dominica, there are lots of questions about the September training, 3-day training, who can participate, and also other questions about the IASC training, the IOM training. How can people access this? Dominica, can you just answer that? Because I think people are interested. Who will participate in the 3-day training?
Okay, the 3 days training, it's based, unfortunately, is by invitation only, but it is, yes, it's mainly for people that have been consulted, PSCA coordinator, as I said, GBV coordinator, expert at the global field level from 35 countries, the 35 countries that they are the priority country on PSCA by the Interagency Standing Committee, PSCA Secretariat. But if you really would, it is a workshop, it is not a training, and we cannot have a lot of people, otherwise we cannot have meaningful discussion, because the outcome will be about tips and recommendation on how to strengthen the coordination. But we're having a follow-up session that could be open to everyone, will be to share the findings, and also the recording will be happening in 4 languages, will be published of those sessions, as well as the materials. It will be translated in English, in Spanish, in Arabic, and in French.
Thank you, that's very useful. And Mariska, do you want to say anything about how can people who are not in our agencies access some of the great trainings that you've developed?
There is a great training that is available on the IASC website called Saying No to Sexual Misconduct for implementing partners. So this is really the standardized IASC PSCA training that is available for everyone. So this is specifically to raise awareness on the issue, make sure that everyone knows the standards of conduct within the organization and the reporting. Yeah.
So if you can also put the link in the chat, people would really, that's a way of getting people access. And just to finish off that conversation, WHO has its open WHO platform with 5.7 million course enrollment. So we are opening a special channel on that, linking to all of the available courses, because we have a very big audience who are interested. And all, of course, WHO's courses will go on there, as well as our own iLearning. So thank you. The last speaker, Clifford Isabel, you've waited very patiently. You're the Global Safeguarding Director at Oxfam, Great Britain. You're part of Oxfam's GB's leadership team, and I know you work with a team of experienced safeguarding colleagues really to ensure this is implemented across your organization. I had a very nice conversation with you before, and I know you've had other experience working in large-scale safeguarding operations, both within the UK, where you're based, and internationally. And again, I wanted to thank you, Clifford, for your generosity in sharing the many lessons that your organization has learned with WHO. So the floor is yours. Tell us about, how you come at it. So what is your perspective on this? Over.
Great. Thank you very much for inviting me to speak at this event. So I started with Oxfam in 2019. So it was I describe in the thick of it in terms of the regulatory oversight from the Charity Commission and following the Independent Commission. I joined at a time where an action plan had already been agreed, and if you've been following it, it was nearly 100 points that was on our action plan. which was some positives, but also create some problems in terms of having such a big action plan and try to make sustained change. In terms of some of the focus that I wanted to talk for in 5 minutes, linked to kind of where Oxfam were heavily criticised, and one of the main focuses when I joined, it was kind of 3 aspects, and the 3 aspects are kind of linked together. We did a great deal of focus when I started on in relation to case management and investigations. The second point was in relation to a survivor-centred approach. And the third thing was also about speaking out and looking at barriers to reporting. And the 3 are kind of interlinked. And what I will say with all the points that Oxfam are working on is there isn't an end point. And that's really important to highlight, that with safeguarding work, there is no end point. There is no point where we can pat ourselves on the back and say we've got there. It's an ongoing journey, and I think we need to really kind of frame that in any kind of organisation, is safeguarding is an ongoing journey. So in relation to case management, the points I wanted to highlight is within what I introduce and what we work within the team, is we have a number of trained investigators. We have when we're fully staffed, 4 investigators. We also have a team manager who oversees the investigation team and a head of safeguarding. And I think the most important thing to highlight is you need resources. Resources are very important in terms to make sustained change. And what we do in relation to our case management is we have a global system. So we have a case management system. So this isn't about us using Microsoft Word and Excel to kind of log things on. We have a purpose-built system that logs and manages all of our casework. And the reason this is important and having a good case management system is because it's the flow of information. It picks up data, it picks up trends, and this is really important when we link to the other points that I was referring to about survivor-centered approach and speaking out. We've adopted some standard timescales. So in the ideal world, from a point of referral or a report into Oxfam, we have 12 weeks to investigate and report and pass the case over to our HR team, who will or not take the case on into a disciplinary process. And again, the information flows. So what happens if the investigation goes over 3 months? I get alerted, and I need reasons and explanations of why a case is going on a lot longer. And the reason for that is because I think as a sector, and with Oxfam particularly, we're criticised on how long investigations take, and particularly when you have survivors or victims that are sat there wondering what's happening and where am I getting support. If they see a subject of concern still in the workplace, that creates additional more stress and trauma. So we have to move as quickly and safely as possible. Now, the caveat to that, I will say, is sometimes what we find is because when we take a survivor-centered approach, it can take a number of weeks for us to get things to be able to take action in a safe way. So the survivor-centered approach really links into saying, can we take action? Is the survivor safe if we take action? Bear in mind the subject of concern may know who has made a report about them. So one of the things that we find is the most important thing is we will not take action unless the survivor is safe. And that sometimes means that we have to get them to a place of safety. That means we might have to support them to move them. And it sometimes means that we might not take any action, but we take some preventative actions around a situation as well. And one of the things that we find is when we make survivors safe, and this is a very obvious point, when we keep and make survivors safe, we get a much more better quality investigation and intervention from our team, because they are obviously being held safe and in a safe environment as well. And the last point I kind of want to highlight to link to that is our barriers to reporting. I personally have the mindset, and we know global trends, just take it out of the sector, is Psca or SEA, sorry, and forms of sexual harassment and abuse is underreported. Take it out of the sector, it's an underreported thing. So we go in with that mindset within the countries and regions to say, we know it's underreported, what are we doing with it? And if we have that at our forefront of our strategy and in our minds, we go out finding it. And I think this is the most important thing, because if we don't go in for that mindset, we won't be surprised when reports come up. And we work with our country teams, we work with our communities to really look at how do we bridge the gap? How do we understand the reason why people don't report? And what I will say to that is Oxfam published some research, which is on our website, and I'm happy to drop it in the chat box, where we went to Iraq, Myanmar, and Ghana. And we did some extensive research to understand, why don't people report to us? Why don't we hear from people from in the community? We hear from staff on staff, and we really kind of highlighted the issues there that people don't, it doesn't matter how safe it is. Some communities, due to the communities of the culture, they will do things internally. They'll deal with things and they'll work things. And we can sit there and think, right, that's fine. But at Oxfam, we don't. We kind of still look at the next steps to say, right, we need to engage, we need to hear about concerns, because that's a real concern. And that's part of our focus when we go into countries, is to really to engage, educate, and understand from our point of view why we don't hear complaints from some communities. So yeah, they're the kind of three main points. And if there are any kind of questions, I'm more than happy to kind of speak to those a little bit later on.
Thank you. But just because it's directly connected, Anjana, one of our senior colleagues in WHO from Sierra, I think it's her, what percentage of cases result in action against perpetrators? This very impressive benchmark of 120 days, but what percentage? Yeah.
That's a very good question, and we do have access to that, so I can drop in our latest 6-month report. So one of the things that Oxfam does is we every 6 months we publish our findings. So we say, this is how many cases we've had, this is what the result is. So I can drop the most up-to-date link into the box for you all to see.
And fantastic, because in our earlier conversation, I found it quite remarkable. You said most of your complaints are staff complaining about staff. So really having this culture of speaking up in our workforce. So that's also a very interesting point, because I know many UN agencies, and particularly our agencies, we don't have that. There are barriers to staff reporting against staff. So there are a lot of issues to unpack, but I just wanted to highlight that could be something that we could really learn from.
And just the last point I just want to highlight is one of the things that we do every year is we get an external auditor, safeguarding specialist, who comes in and looks at all of our cases and really kind of says, highlights where we're doing well, but where we need to improve. And again, kind of feeds into this learning and improvement framework that we have. Fantastic,
thank you so much. And so let's move on to, I see there are more than 40 questions, but before we go into all of that, and some of them are simple questions. So will you get the link? Yes, you will get a link to all of this. Is there a certificate? No, there isn't a certificate, but we will make sure that you get links to learning opportunities, which may have certificates in them. This is meant to be a conversation. So if we just open up the discussion, let me start with Dr. Sosefal, because I know he's pulled into another meeting as well. So, WHO, so we are part of the Interagency, we're part of the UN, we are scaling up our ability to engage at the country and the global level. But talk us through, Dr. Sose, a little bit, because I know WHO responds to more than 100 emergencies and about 40 to 60 graded emergencies, which are related to, many of them related to disease outbreaks. So what's special about disease outbreaks, right? Because there's a lot of experience in humanitarian aid, in development aid. What would you say, based on your experience, what are the special measures agencies like WHO related to disease outbreaks have to put into place?
Thank you, Gaia. When we are responding to disease outbreak, it's most of the time happening in already very vulnerable setting where you have humanitarian crisis. But in addition to, what we know about the target population, when you are chasing a virus, you can find yourself in every very remote and small village. So making sure that you have the flexible mechanism to interact with communities, to implement prevention of sexual exploitation and abuse, make it very unique. In certain situations, we found ourselves working in hundreds of villages where you will have to really decentralize your operation with a very small team. And that's why it's really, really critical to make sure that the people we are sending to this remote area are really aware of the issues, are really planned and brief about the risk. But also, when we are engaged with communities, making sure that in the remote area, community are fully brief is another challenge. We still have the gap between what we do as a UN and what we need to build in terms of capacity at community level. And another thing is, anytime we are responding to this outbreak, you mentioned, and actually we are responding to more than 100 outbreaks, every year. We just mentioned the ones that are graded, meaning the biggest one. But at all times, we need to make sure that our country offices, the people we are employing in all countries are fully briefed, are managed, and are accountable for everything they are doing, even if they are alone working in a village. So this makes it really, very energy and investment demanding. We need to maintain building capacity, change the culture. So when people work in this very difficult environment with a very vulnerable population, they will be more in kind of protecting the population while causing the virus. Thank you.
Thank you so much. And I know, and many of you, Clifford, Wendy, and many of you touched on this, the issue of existing culture. So we have to be very clear. As in the UN, as humanitarian development workers, regardless of the local culture, we have to protect against SEA. For example, and many people have mentioned this, even if it is legal to have sex or marry a person under 18 years old, if any of us engages in activities like that with anybody under 18, even if you thought they were 18 or plus, will constitute sexual exploitation and abuse. Issues like this. So regardless of the local culture, we have to stick to our standard of conduct especially related to SEA. So this is a very important point. And I see a lot of comments about how culture, harassment, the treatment of women. So the whole of our system is trying to improve human rights, preventing gender-based violence. So we cannot be contributing to this, regardless of the reality and the context on the ground. So I want to move back, Wendy, if I can call on you next. You've talked about, and I know, I was around in emergencies when the health cluster and the IASC were reformed, and we have very different interests now, right? So in the beginning, we were focused on many things. Now this has become a very complex issue, and you're doing great work, and the IASC is doing great work. So I think it's really linked to how you see the effectiveness of interagency work in this, but particularly related to, the work we're doing is focused on coordinating amongst each other. What do you think, about how we should engage more with government, implementing partners and others? Can you speak to us a little bit more on that? You've touched on it, but a bit more on how we must engage governments and partners in order to really have impact at the community level.
Yeah, so what we've seen is when there are instances of abuse or misconduct, sometimes it's not clear who is the perpetrator, which affiliation they are, whether they're a partner or a UN organization. But it does taint the whole operation. It taints our trust with the communities we're trying to serve. It taints the effectiveness of our intervention. So that's why the work that we're doing on ensuring that there is a harmonized approach and understanding of the codes of conduct with any implementing partner, with any of our partners that we're working in those areas of operations, if they're delivering assistance that we're providing, should be upheld to the same standard. And why it's important also that as part of that, of our programming, as Mariska mentioned, there are safe, accessible, and trusted methods to provide feedback on how we're doing and if there are any possible abuses during aid delivery. We are seeing in different contexts, we have seen some good practice where we have government counterparts that are engaging with our PSEA networks, that are partners, that are members, ministries, sometimes the ministries that are dealing particularly with gender or women's issues. but we do need to look more how we would systematically engage and have a joint code of conduct. Again, in many situations where humanitarians are working, we're actually operating in areas where substituting services. So we're really trying to hold ourselves to account in terms of how we're operating. The UN in 2018 published a protocol on working with implementing partners that requires all partners to have the same standards of conduct, and also a partnership in terms of ensuring that we are providing that capacity for our partners to be able to prevent, train their staff, have codes of conduct, and if there is a case, we have the UN would assist in some cases on conducting the investigations. So, I think we definitely need to still continue to work. As I mentioned, in some places, we don't have such a luxury of choosing many different partners, and we need to then work with those that do have access and do have the trust of the communities. I think that we have also the challenge. I really much appreciate what Clifford mentioned about in terms of how they do external auditing or reporting on systems, because the challenge is how do we measure whether what policies we put in place are effective, and how do we measure the implementation of these policies? So in many places we have good practices, but we do need to go back and check that it's well understood and that we're implementing them and they have the capacity to carry them out. So I'll stop there. Thanks.
Thank you so much. And at this point, there is actually there are many questions related to communities, and I just want to say that we are going to have a dedicated webinar on communities. And there was a very poignant question. Here is the double standard for you, an employee, and other employees to speak. How can a poor girl raise her voice in this sensitive issue? Totally. I mean, this is the crux of the matter, and we will be looking at it. And one of the discussions we're having in the system is how to help people who experience this to speak out, but also not to put all the burden of reporting on them as well. So we will absolutely discuss this. In some agencies promote community-based reporting mechanisms. Others work through community-based trusted organizations to help raise the voice. But it's not just about raising a voice, it's about the comprehensive set of services, from protection to medical to psychosocial, and even livelihood and so on. So it's a very complex issue. Thank you for raising it. I'm not ignoring it. I just want to say that this is really at the heart of this conversation, but we want to dedicate a whole session on victim survivor-based approach and what we really can do to help prevent, but also report and respond. Let me turn to, we have another colleague from UNFPA, Carly Owens. You're a specialist in protection from sexual exploitation, abuse, and sexual harassment. And I know you also focus on counter trafficking and many other very challenging issues. Carly, I know UNFPA actually feels very strongly SEA is a form of gender-based violence, and you've actually done work to explore the linkages between these two things. Can you share with us the main findings of the research you have done? Because as was said, we really need the data and the evidence to see what is working and where we can go. How do you think we can improve safe, ethical access for victims and survivors to access gender-based violence support services? So take a little bit more time, because I think this is really important. Go ahead, Carly.
Thank you, Guy, and thank you for this opportunity to participate in the webinar. It's very interesting, and I'm really loving hearing all the challenges that my colleagues are presenting, and how a lot of this is reflected in the research that I did last year. So in 2020, UNFPA conducted analysis on GBV, Psca, and referral systems, improving safe and ethical access for victims of SCA to GBV support services. This is building upon the notion that GBV support services are the appropriate response services for victims of SCA. It's also promoting the idea that Psca is not a standalone pillar, but linked to existing interagency mechanisms and interagency accountability, especially when it comes to victim assistance. So this analysis was accomplished through a literature review, key informant interviews, and a survey with respondents from over 70 organizations. Specifically, the analysis sought to address 3 main points, which are understanding the current status of victim assistance for victims of SEA and understanding the status of the perception of PSEA into GBV interagency mechanisms as they pertain to victim assistance. So this is really looking into GBV referral pathways, for example. The analysis also sought to understand and identify gaps in services for victims of SEA. So I'll just go through some of the main findings, which kind of echo some of the sentiments of what my colleagues were just saying. Okay, so one of the key findings from the analysis is that there are a number of sensitive topics related to victim assistance where there is no or there is very limited guidance. We have the UN Protocol on Victim Assistance, which UNICEF and the IASC is releasing guidance on this year in training. However, we have very little guidance on very sensitive topics, such as addressing risks of retaliation, creating safety and protection plans, which is also listed in the protocol. This idea that we're supposed to be protecting victims or people who come forward with allegations. But how do we do that? Where's the guidance? How long? What is that? These are all really important questions that need to be addressed. Another sensitive topic might be providing support for children who are born as a result of SEA. Again, what type of support is that? How long do we offer that support? Is it until the age of 18? We're not really sure. We are aware that children exist as a result of these crimes that are taking place, but the support for these children and their families and their mothers is really happening on an ad hoc basis. For instance, I was put in touch with a case in Haiti where a child was receiving support basically on a 6-month basis. There was no real solution except for, providing school fees and things like that on a very limited basis. We don't have any guidance on reparations for victims of SEA. I mean, these are huge topics, obviously, but I think we need to get the conversation going. We need to start with some type of guidance. As my colleague Domenica was mentioning, as part of the championship, we're going to be looking at GBV case management and the integration of PSEA. In particular, guidance on mandatory reporting and zero tolerance can be quite complicated for case managers, and putting them in a situation where they're wanting to protect a victim, but also they are obligated to their organization to report any alleged, even rumor of SEA. So this can put them in a quite precarious situation. So we're hoping to kind of tackle that issue a bit with these case management guidelines that will come out at the end of the year. So that's about it from my side. I'm aware we don't have too much time, but I'd really be happy to answer any of your questions. And also I can send the report through to this group if that's
really good. And also I think there are GBV related issues in some of the questions as well. So if you feel like that you could contribute to that, that would be fantastic as well. Where are we now? We should go. Mariska, I didn't go back to you. So, you've already really talked about the work you're doing to support the whole community. How can PSCA network focal points coordinate better? You've already touched on this. Are there any additional points on this? Because what are the best practices? So for example, can you give an example of a best practice of where this is happening that we could really work towards?
Yeah, absolutely. Thanks so much, Gaia. We have a lot of good practices to share on increasing coordination in networks between PSEA focal points within the networks of PSEA coordinators who are chairing the network. But let me just start by saying that we do have standardized PSEA focal point terms of reference that will come out in the IASC very, very soon. They are currently being endorsed, and this is really kind of the standardized terms of reference for PSEA focal points. And why am I saying this? Because as part of the PSEA focal point role, an important segment of their role is to coordinate within the PSCA network and to contribute to our collective deliverables on PSCA. As I previously mentioned, it's really important for PSCA focal points to be capacitated on their role, that they are capacitated, that they have within their terms of reference the time to dedicate to PSCA within their role, that they have it within their job evaluations, but most importantly, that they have the senior leadership support within their organization to move this forward. And what I would really like to say in respect to that is that having senior leadership support both means that PSCA focal points should have the time to dedicate to your role, but also have the resources, so the financial resources to effectively put PSCA on the agenda, do awareness raising, do staff trainings, do all of those important things that will just take human and financial resources. Key takeaway also to flag is that the PSCA focal point in and of itself does not do investigations. This is taken care of by specialized trained investigation units within organizations. Also emphasizing that PSCA focal points do not provide services to victims of sexual exploitation and abuse, because there are, again, as Carly was also emphasizing, specialized services mostly provided by gender-based violence, case management. So PSCA focal points will not be asked to carry out those tasks. As I also mentioned, it's really good practice, and to go back to the good practice that we see, it's good practice to have a dedicated PSCA coordinator at country level. So if you remember the diagram, that's like the in between the senior leadership and the technical level, right? So we've seen that we can really create a lot of momentum, push the agenda of PSCA more forward when we have a dedicated interagency PSCA coordinator who is operating at country level. I can share also with you the generic TORs of the PSCA coordinator if you want to see more of what it entails. And what our team also has created is a deployment package for PSCA coordinators, which really lists what the coordinator will be doing, what key resources exist. And I just want to emphasize that for the people on this call that are wondering, we don't have a PSCA coordinator in our country, in the country where we are operating. What do we do now? Is just to say that while it is a good practice, we do have a lot of responses where PSCA focal points that are highly capacitated do take on several roles that are carried out by PSCA coordinators. So looking at the deployment package is a really good idea when you're a PSCA focal point and you want to contribute to the collective. So I will definitely put that in the chat.
Thank you.
Two more quick examples of good practice in terms of coordination. The PSCA network, it's very essential for them to have a work plan with collective deliverables and with, again, the measurable indicators of what will happen at the collective level on PSCA. So what we've seen, for instance, in Libya is that they have, before drafting the PSCA network work plan, they started with doing an SEA risk assessment to identify what the needs are present in country, what community preferences are to how people prefer to complain to our complaint mechanisms, how people want to be approached, and then taking all that information from the SEA risk assessment, which was done in a joint way. So within the network, they did that joint risk assessment. They could draft the PSCA network work plan. Another good example that we see, and this is one of the main deliverables also of the PSCA program as a whole, is to have standard operating procedures to refer allegations of sexual exploitation and abuse. So imagine you're working in a context and you, as a PSA focal point, you hear about an SEA allegation that is perpetrated by a staff member of another organization. So not your own organization, but carried out by another organization. You need to have standardized operating procedures to know exactly who to contact, to know exactly who to inform, to know exactly how you will refer the victim or survivor to the services they need. So that's why at the interagency level, we need those standardized operating procedures, which is also called so-called interagency community-based complaint mechanism, right? As part of that, we need those procedures that anyone can just pick up and follow, which is absolutely essential. Thank you so much.
No, thank you. So it's really important to hear these examples. Clifford, you were very honest about some of the challenges you had already, but I was particularly impressed because I know you've had a long and hard journey, and you set benchmarks. Also, I wanted to say, you know, when I started, I inherited a list of about 80 activities, so I know how you felt. So tell us a little bit more about the benchmarks and standards that Oxfam has for this area of work. But how, and more importantly, how do you, it's one thing having standards, how do you ensure that these are implemented and met? And what is the one big challenge that you have in this area at the moment?
Yeah, so when I first joined the organisation, you know, I was myself. It was just myself and the manager and some of the safeguarding advisors. We built our team, and when I say we were constantly tinkering with processes to kind of keep evaluating and changing. So we didn't take, you know, we were always looking to improve our standards, and to do that, you need to keep tinkering with your processes to ensure that where there are learning from cases, you adopt and you change your processes to deal with that. And that's where, you know, in terms of our procedures, we have a safeguarding and ethics committee where our lead trustee, who is a safeguarding lead, she sits on there. So there's a really good governance oversight that keeps pushing our team, questioning our team, and we meet kind of every quarter. We're obviously very transparent with our information that we publish externally as well. And that's another thing that we're going to continue to do, because that's just who we are now as an organization. But in terms of challenges, you know, one of the things that I suppose that there's an obvious challenge when you work in Oxfam is this media exposure. And the reason why this is important, because every time something like that happens, it really knocks the confidence of staff and the communities we work in. And it's that confidence building. We know that there's a lack of trust within systems, within the sector. We know there's issues around confidentiality and people not trusting the systems, and very like what Mariska says, you know, if on our intranet, people can see our standard operating procedures, which clearly document, if I click this report button, who will contact me? Where will the reports go to? And we get held to account for that through our auditing systems. And that's really important that we are held to account if and when, you know, we do not follow those procedures. But really, what, you know, the barrier, you know, if I think about staff and our communities, is we've got to build that trust. And this is why we focus so much on our case management processes and survivor-centered approaches, because we've got to keep building that trust. But we've got to also be honest internally and externally about the challenges we face. I think far too many times our narrative can be reactive and defensive, rather than kind of saying, you know, we are on a learning and improvement journey. We're not going to get it right all the time, but these are you know, and showing staff in our community the direction of travel that we are moving to. And I'm of course I'm making it sound a lot easier said than done. It's a complex challenge, and as people have highlighted in there, it feels like within the sector we're still working in silos. It still feels like we are working in isolation within the sector. And I like what I think Mariska, you said, you know, this one voice. We do need to create that one voice, because what we need to do is that one voice will create SEA situation socially unacceptable. And I know many of us know that it is socially unacceptable, but we need to kind of collectively move forward and ensure that it's socially unacceptable moving forward.
Thank you so much, Clifford. And that's what we've been talking about, is how do we establish the social norm within our organizations, with our partners, with our collaborators, that this becomes common, not only common knowledge, but common sense and common practice. And we have a long way to go. I'm going to ask Mariska one more question, and then I'm going to ask all the speakers to speak within 1 minute to say, what is your personal takeaway? What did you learn from this, the speakers? And what is the takeaway you want to give to the participants? I've tried to weave in the questions that have been asked into this, but actually what we can do is we can give some written answers as well afterwards, because this will be hosted in a place you can access. So while everybody thinks of what is the one thing you learned yourself, speakers, and what is the takeaway for the audience, I'm going to, Mariska, I'm going to ask you a different question, and so you'll be the last to speak, okay? So the question I wanted to ask you was a follow-up that's in the chat here. You talked about risk assessment, and I know there is an interagency process for assessing risk. So Adelaide here has asked, how do you do risk assessment? Does it involve communities? How does that work? Can you speak a couple of minutes on that, and then I'm going to come up to the wrap-up. Thank you.
Absolutely happy to share some practices that we've seen in country. So when we talk about joint SEA risk assessment, what we mean is both assessing at the collective level how organizations are doing without blaming anyone, without pointing fingers, but just to see where we can further improve. Where organizations might need support, where we can do peer learning, where we can support each other. That is the key message there. And then secondly, what is good practice and what we've seen happening is that an element of the SEA risk assessment is to have community consultations to really go into, okay, what do communities see as the key barriers to reporting? How do they prefer to report? Where do they see themselves the main risk of sexual exploitation and abuse within their communities, with aid workers, with development workers? Where, what do they think? How do they assess our programs? We really need to move from just looking at our own policies to, okay, how do beneficiaries actually perceive this? How do are they happy with the systems that we provide them and with the programs? So those two elements are considered good practice to include in the joint risk assessment. Over.
Thank you so much. And I want to acknowledge in some of the questions, we are talking about populations or communities or women as a homogeneous group, but there are increased vulnerabilities. So disabled people have written about mentally disabled, physically disabled children. So within a group, we can have individuals who are even more at risk to SEA and to any other form of exploitation. So absolutely, we haven't touched on it, but I want to acknowledge that many of you are speaking from the heart about that as well. So speakers, what have you learned and what is your message to the audience? So let me start, Dominica, let me start with you.
Thanks. Well, what I learned that the more we talk to each other, the more we coordinate, the more we have a coherence in our approaching. And when it comes to victim assistance, we learn more between the two areas, and we learn to build, and then also the survivor will build the trust, will be more credible in the face of the community. So this is what I learned.
Yeah, and do you have a message to the audience before you leave?
This is my message.
That's your message, okay. Carly, next to you. Carly, what have you learned, particularly during this 30 minutes from this conversation? And what is it you want everyone to remember?
I guess key takeaway or message that I would like to convey is really appreciating the victim-centered approach and respecting the rights and the wishes of the survivors, and ensuring that they're, treated with dignity and respect. And I'm hearing a lot of challenges from my colleagues today, but also a lot of, opportunities coming in the future and these guidance and these trainings and things. It's all really great. But I'd like to see throughout all of this kind of mainstream the victim or survivor-centered approach. I think it's really important that we don't lose track of that. So that's all. And thank you so much for this opportunity. I really appreciate it.
Thank you, Carly. Dr. Sose, are you still on? I'm not sure if he's on. If you're on, feel free to unmute. But let me go to Wendy next.
Thanks, Gaia. What I've learned and what I've been reflecting a lot is on working on this topic is there a way we can better pool our resources? And I think what when we spoke about doing external audit or peer-to-peer learning or even peer reviews, I think would be really helpful for us to see what really makes a difference and how we're doing in terms of implementation. In terms of takeaways that I'd like the audience to reflect upon is really think about how we're communicating with each other and promoting this culture of respect, to be transparent organizationally about what we're doing to really strengthen our protection from sexual exploitation and abuse, and ensure that you're engaging with the people that you're trying to help in the communities we're serving. I think there's a slogan, nothing about us without us, when we're working in communities, that people really should if you're trying to help them, then they should have a voice in how you're designing that help. I'll stop there. Thanks.
Thank you so much. Mariska, did you want to add something? I know you integrated your answer, but is there anything else you'd like to add?
Just to say thank you to everyone. I have learned a lot from this webinar myself. I love it when we all come together. I read the chat. Thank you for all your amazing inputs. It's been really useful. The key takeaway for me would be having clear roles and responsibilities, like improve coordination. Don't be afraid to ask for help. We're all learning on Psca every day. Neither of us is perfect. We shouldn't point fingers between organizations, between colleagues, but really push to help each other forward and dare to ask for help. So that would be my key takeaway. Also, I will put my email address in the chat box if anyone has any additional questions. Over. Thank you so much.
Thank you so much. Clifford, what have you learned and what do you want people to take away?
What have I learned? I've learned that we're all singing a similar song in many ways, and that's reassuring. And as I mentioned, it does feel like sometimes you're working in isolation. So it's lovely to be part of this and hearing, all the good things that are going on and what people are doing. So that's been really positive. And a message for the participants. And seeing all the comments and everything now, safeguarding is everyone's responsibility. It doesn't fall on just to a safeguarding team or a safeguarding lead. So it's really thinking about how you can connect with safeguarding better and how you can develop yourself as a safeguarding practitioner. So that's one of the key messages I'd like to give.
Thank you so much. Awa, are you on? Can you just show your face? Because I wanted everyone to know it was actually Awa Nadir from my team who organized this, and I really want to express my gratitude to her. Awa, would you like to say something? Because she also manages our global network of Psca experts, about 45. Go ahead, what have you learned and what's your message?
Yeah, thank you very much, Gaia. Thank you to all the panelists. I learned quite a lot, and I hope that the network of Psca members who are all here from WHO, the 45 that we have, and the others from the other regions have learned a lot, because ultimately what we want to do is really to bring all our networks together, because as some of the panelists said, we should speak the same voice, because on the field, we do not make the distinction. So any allegation is not towards one organization, but for everybody. So we really need to join our efforts and see ultimately what we are here to do is to protect the communities we serve, how we can better protect them. So the Psca focal points are doing an amazing job on the field, but really how to engage more with the communities, how to integrate the GBV actors, and really how to be closer to the communities. So my main takeaway is really let's build that community together and to improve our workforce and have some dedicated personnel for PSEA, because we really need to be stronger to be able to achieve this combat. So thank you very much to all.
Thank you. Thank you to all the speakers. I'm extremely grateful for your generosity. As I said, as I took on this job, all of you advised, helped. Also, there are many, many people in the audience who joined, but I also see some of our senior accountability directors and their teams are on. I really want to appreciate everybody's participation. We will have different people as speakers in consecutive webinars, because I believe we learn from each other. Thank you for your patience, audience, and I apologize, the closed captioning didn't come on until towards the end. We had a technical difficulty. I really apologize. You will all receive the link. We will make sure you have that, and make sure that you have more time next time to register and invite your colleagues to join as well. I hope this was a good learning opportunity. Learning isn't only about knowledge, it is also about our attitudes. And if we feel strongly that we have to act in the right way related to protecting people from SCA in any circumstance, under any circumstance, no excuses. And we all know, as Clifford and others said, everybody has a role to play. Everybody has a role to play. So with that, I want to say thank you. I look forward to seeing you in the next webinar. Thank you again, colleagues from other agencies, and thank you for the speakers. It was really wonderful being with you. Have a wonderful rest of the week, and we will be in touch with the follow-up information. Take care. Bye.
Thank you, Gaia. Thanks, everyone.
Thank you.
Bye.
Thank you, everybody, for wonderful feedback. That's very kind of all of you. Thank you.